Life is just all about harvesting energy from the environment and using it to create order. And if you don't have enough energy in the system to maintain the order, you get disease. Things start to break down. And so the first place that the body seems to sacrifice is the lining of the arteries. I had a massive heart attack on 34 years old. It was a 100% blockage of the left anterior descending artery. No signs or symptoms, no diagnosed heart disease before that. And so we should be focusing on ways to protect the lining of the artery and how we keep blood moving and preventing clotting from happening. Instead, we've been distracted by these lipid biomolecules in the bloodstream because of the story that Ansel Keys gave us of cholesterol being the cause back in the 50s and 60s. And so if we want to protect the lining of the artery from damage, we build structured water because nothing can penetrate it, right? I've really delved into heart disease and atherosclerosis and heart attacks, and what I've learned has just completely blown my mind. I feel like I should share the information at least so people can make more educated health decisions, because I know they're not going to get this information from Western medicine.
What would you say are the most common misconceptions people have when it comes to the heart and heart disease?
Well, there's many. And I would say the main one that people are familiar with probably is this whole cholesterol theory of heart disease. I think that is the biggest myth around, the biggest distraction, I would say, from heart disease. But also things like the heart is the mover of the blood, or the main mover of the blood, which I think is also a big misconception. And then the actual roles of the heart, if it's not to move blood, then what would it be? We've misunderstood what the role of the heart in the body is. But I think the conversation around animal foods and heart disease is also a big myth. And they are not the cause of heart disease, nor do they contribute in any way. I think those are the big ones.
All right, you mentioned cholesterol right off the bat. Let's jump into that and talk about classically what people consider is happening there, and then how you see it.
Yeah. So I guess the traditional theory or thinking, I guess the mainstream thinking, is that you get high cholesterol, or what we're really talking about is lipids, so blood lipids. So people know of LDL and HDL and things like that. And those things get high in the blood, and that they somehow get stuck to the lining of the artery, and they build up this plaque formation. And that has just never really been shown to be true. There's lots of studies out there that, if you look at them, are heavily funded and I would say influenced by industry, different industries that want that theory to be true for financial gain. And most of the studies suggesting that suffer from that issue. But there's the blood is not, or the lipids aren't happening in a vacuum in the blood. So I kind of approach this logically first. There's many other things in the blood. There's water. The blood is half water. There's electrolytes. There's clotting factors. There's red blood cells. There's the glycocalyx. There's all these different things in the blood and in the artery. And so to, I guess, think about heart disease as this one substance in the blood, these lipids in the blood that carry cholesterol, that doesn't make sense. We're ignoring all the other things there. So this is something that's happening in the artery, within the blood or near the blood, and we're ignoring everything else. And we think, oh, it's just this thing. And it reminds me of this experiment that was done in 1886 or 1887. I can't remember which one, called the Michelson-Morley experiment. And in this experiment, they were trying to test and see if there was an ether, which is basically just the empty space there, what's consisted of the empty space around us, right? And so they were trying to see if there was a medium through which light could travel, and that it needed to travel. And in that experiment, it was the results of that experiment were misinterpreted, and they said, oh, no ether exists. And that was, a lot of physicists at the time were like, oh, yes, this is awesome that it doesn't exist. That makes it way more easier to do my mathematical equations if I don't have to account for an ether, right? Or a medium through which light has to travel. And it's the same thing with this cholesterol theory. It's like if we ignore everything else there and we just say, oh, lipids, it made it very easy to say, or to develop a theory that these lipids infiltrate the lining of the artery and cause plaque to form. But there's major issues with that theory. One is that when you look at what plaque is made of, it's clotting tissue, like the vast majority of it. I'd say 87% based on some studies, plus or minus 8%, depending on which person they looked at, it was clotting tissue, and there was very little cholesterol present. So if it's not, cholesterol, then why are we saying cholesterol is driving this disease process? And I've had people tell me, Well, cholesterol initiates the issue, and then the plaque forms after, the clotting tissue forms afterwards. And, that's all well and good, but we have plenty of literature that shows that platelets and clotting factors initiate atherosclerosis and play a role throughout the entire process of it. So it's this clotting tissue that forms. And so there's no situation where a lipid, an LDL molecule, says, okay, I'm going to go embed myself into the lining of the artery today because that's just what I do. And if you look at the entire environment of the arteries and you realize that there's water there, and I'm sure we'll get into structured water and what that is, and how structured water, like how some of the water in the blood actually congeals itself or forms this gel on the lining of the arteries, and that nothing can penetrate that gel based on the properties of this water, then if you have intact structured water there, then nothing's going to penetrate it. Lipids are way too big to get even close to the artery wall. Now, if there's damage, then yes, lots of things can access the artery wall, but it's the response to damage that causes plaque to form, this clotting tissue. So you got to think of it like the same thing that happens if I cut my skin. If there's damage to something, my body responds by developing clotting tissue, a scab, because it can't heal that instantly. It has to stop the bleeding so that the body can heal it over time. And when we get damage to the lining of an artery, a similar thing happens. We get clotting tissue that forms and stops that artery from becoming too damaged so that it doesn't rupture, because that would be internally bleeding, and that's a much bigger problem. And so it develops this plaque. And the inability to heal the artery is what leads to the development of more and more plaque. So there's a reason that we see type 2 diabetes being the number one risk factor for development of atherosclerosis, because with type 2 diabetes, you see impaired wound healing. And so if you can't repair the wound on the inside of the lining artery, it sticks around and we get more and more plaque development. And so we should be focusing on ways to protect the lining of the artery and how we keep blood moving and preventing clotting from happening. That should be the main focus of heart disease. And instead, we've been distracted by these lipid biomolecules in the bloodstream because of the story of that Ansel Keys gave us, of cholesterol being the cause back in the 50s and 60s. And we've been stuck on that idea ever since.
I want to really get in here and differentiate where these two stories diverge. We would all agree that there are these particles in the blood. There is damage happening in the artery. Where is that process different between the two paradigms?
Well, there's some people out there that say that it's this. They say this response to retention theory, where there's damage that happens. But there's some people that say that no damage. I was listening to a lipidologist the other day that somebody asked me to listen to and ask my opinion of, who said that no damage has to be present, and lipids can enter the lining of the artery regardless, especially ApoB, they say. And that's just not true if you understand the fact that structured water forms in the lining of the artery. And this structured water protects anything from getting there. So if you have healthy arteries, there's no way any biomolecule is going to touch it aside from very small hydrated ions of minerals. So that's the thing, is that, again, going back to the fact that they're acting like the lipids are the only thing that matter, and they're ignoring everything else that happens in the artery, in the blood. And without that information, how can you have a full idea of what atherosclerosis is if you're ignoring everything else? And that's the main issue for me, is that, they're ignoring all that stuff. And they're just not looking at different information. So that's where it really differs, is that you have to look at this as a complex system with many, multiple factors. And when you do that and you account for all those factors, then you see this other path. Because like in the 1950s, when heart disease was becoming an issue, coronary artery disease, because in the early 1900s, it wasn't really an issue. It was very rare to have coronary artery disease. And then in the 50s, President Eisenhower famously had a heart attack while he was in office, and everybody was scared about this new disease. And so they came up, Ansel Keys and his team decided to give people an answer, and they did some poorly done research at the time. There was epidemiology that just associated cholesterol with heart disease, and they cherry picked the data. So they only picked the data that gave them the correlation that they wanted, and they ignored everything else that happens in blood. And so that was a huge issue. But at that time, which many people don't know, there was also a scientist named Meyer Texon, who was adamant about this disease being basically a clotting issue due to interrupted or poor blood flow, which is what happens. Like Rudolf Virchow back in 1856 told us that what causes clotting is poor blood flow, damage to the lining of the artery, and sticky blood that's too viscous. And so when you think about that, and you realize that even during the early, research into heart disease and this new epidemic we were having, there were people saying that, look, I can cause atherosclerosis by interfering with blood flow and creating clotting. But there was all this money behind this cholesterol theory because the pharmaceutical industry had a drug that could lower cholesterol. So they were putting a lot of money behind that theory so that they could sell drugs. The food industry, processed food industry wanted that theory to be true because then they could demonize saturated fat and cholesterol in animal foods, and you could eat more processed foods, processed carbohydrate foods. And so there was money behind this theory, and there's very documented evidence that money was given to support this theory. And so it just kind of took off despite this other evidence that was there. And now we're stuck in that. So the way that these two theories differ was financially a lot of it was financial push for them. And if you look at the early studies that Ansel Keys and many other, there's probably 5 or 6 studies that were done in the 60s and 70s that were testing, saturated fat consumption and cholesterol levels versus like actual interventional trials where they replaced saturated fat in the diet with unsaturated fat. And they found every single one of those trials found that the more unsaturated fat, less cholesterol you ate, the more heart disease people had. So there was never any research to back this up in the first place. So I find it very, very interesting that these days you have to provide so much evidence against the theory to prove that it's not right when there was never evidence in the first place. So, yeah.
So you mentioned this one lipidologist that believes that just having the presence of these substances in the blood is enough to initiate this whole cascade. When it comes to conventional thinking, where it's assumed that there is some kind of damage there to initiate everything, is there agreement between the way you look at it versus conventional of what's causing that damage?
Yeah, I would say so. They acknowledge that there are things that can damage the lining of the artery. The big issue I have is they're saying that no damage has to take place for lipids to be deposited in the artery, which in my opinion, that never happens regardless of damage anyways. It's clotting tissue that forms on the artery when there's damage. But yes, I have heard many people on both sides say that insulin resistance is an issue. Being insulin resistant, being diabetic, or even pre-diabetic, or before that, you could be insulin resistant well before you're diabetic, or various toxins, or stress can all be these inflammatory things for the lining of the artery. And I think there is some agreement on that those types of things can be. But I would argue also that a bigger role is played by the things that interfere with the body's ability to heal the damage once it's happened. That's what leads to this plaque development over time, because the body doesn't want that there. It's lost the ability to heal it, which is largely due to the fact that we have an epidemic of poor metabolic health in diabetes. But even if you're not diabetic, having poor metabolic health, high insulin, high leptin, but also disrupted circadian rhythm, which is a huge issue. And there's tons of literature showing that artificial light environments disrupting our circadian rhythm are leading to that metabolic issue. So that's what's interfering with the body's ability to heal it once it's happened.
All right, we're going to move into the way you see things with the structured water here in a bit. But I really want to make sure before we get into this, we've laid the groundwork versus the way you're seeing it and conventional medicine. And the other piece I really want to make sure we dive into is when there is damage and plaque forms, how you see that happening versus conventional.
Well, so they would say that, I guess conventionally they would say that, like I said, they would say there's no damage has to be happening, and that lipids, if they're high enough or they're too high in the blood, they just go and they just find their way in between the endothelial cells. And if enough of them do that, we develop this fatty streak, is what they call it. To me, that fatty streak we're seeing is just damage to the lining of the artery. And so then the body responds to that, and more plaque or more cholesterol gets deposited in there, and it just builds up this cholesterol fatty deposit because there's too much cholesterol in the blood. That's what they would say. and that slowly this keeps growing and growing and growing, and that it gets bigger and bigger and blocks an artery. And that's, I guess, generally their theory. And they would say that certain lipoproteins do that more readily. There's a lot of evidence now coming out that LDL is not the cause of that. So the lipidologists are saying, oh, yeah, it wasn't the LDL. It's a specific subset of LDL, which is the ApoB. That's the one that's the problem. But again, we'll talk about why that can't be when I talk about how I lay it out for myself. But yeah, so they're all focusing on the lipids, and they're saying that they can infiltrate the lining of the artery. And if there's too many of them, that doesn't make sense. Like, to me, because if lipids are high in the blood, first of all, when you take a lipid test, that was what it was at one snapshot in time. So when you look at your lab test, like that's what it was. It's not what it is right now. And Dave Feldman and many others have shown that your lipid levels change drastically throughout the day, especially throughout the week. So that's one snapshot in time. Your lipid levels are always moving because they're based on our metabolism, and our metabolism changes all the time based on our environment. So, but they would say that they go in there and they can infiltrate the lining of the artery. But if that's the case, and lipids are high in the blood, let's say, they're high everywhere in the blood. So why do we see atherosclerosis more in some places and not others, right? Atherosclerosis only occurs in arteries. It doesn't occur in veins, and there's lipids in the veins. So why don't we see atherosclerosis in veins? And people will say, because veins can't develop atherosclerosis. Well, when you take a vein and do a bypass surgery, guess what happens to that vein? It develops atherosclerosis. So it can't be just merely the fact that there's lipids there. There has to be something else. And I would say the lipids are largely irrelevant, and they're the wrong biomarker to be looking at. So yeah, that's their way of thinking. So do you want me to outline my way, what I think?
Yeah, let's give a specific example of your way of thinking. Just hypothetical, create an initiating factor, and then take me through the process of what's happening.
So I'll give a very specific example of an initiating factor because it happened to me. And this is not something that's in my book, so this is a bonus, right? One thing I wish I could make it longer. So I had a heart cath done, and after the heart cath, so they went in through the artery in my leg, in my groin, the femoral artery, to do the heart cath. And my leg was fine the morning of the heart cath, before the heart cath, because I did a sprint workout and everything was fine. My leg felt fine. And then about a month after that heart cath, I was noticing that I was getting pain in my lower leg, so below the knee, and didn't know what was going on for a long time. I was like, what is this? Is it DVT? Is it a compartment syndrome? What's going on here? And eventually, found out that because of the heart cath and the device they used to seal the artery after the heart cath, I developed plaque in my leg, in the upper part or the lower part of my thigh in the femoral artery, which is a very common place for it to happen. And so the only thing that happened there that was different was the change in blood flow dynamics that happened going into my leg. And so as like this device was sitting there, and part of it's on the inside of the artery. So when the blood's flowing past it, it kind of disturbs it and messes with it and makes it eddy and that kind of stuff. And so it was pooling up in that area, and that pooling up developed clotting tissue. It's this lack of blood flow or interrupted blood flow that caused it. And I developed it right there downstream from where that device was. And it happened very fast, because I've had many people tell me that, these studies on people with high LDL after 5 or 6 years and they don't have plaque yet. Yeah, well, it takes a long time to develop. Well, guess what? This was like less than a month when it developed for me. This interruption of blood flow, this clotting tissue formed. And so, yeah, I couldn't even walk to the airport fast without pain in my leg. And so that's one thing that could contribute to plaque formation is interrupted blood flow. And like I said, Rudolf Virchow told us that way back in 1856. He said, this is what causes clotting in an artery. He said, damage to the lining of the artery in response to that, interrupted blood flow, and when blood gets too sticky or too viscous, when our blood is not thin, so to speak. So that's one thing. And that's a major thing that mattered to me personally. So that's one example of what can develop clotting tissue. But it could also be a acute toxin exposure that overwhelmingly damaged the artery. So one thing in particular could be endotoxemia, which is when you get gram-negative bacteria from the digestive tract, somewhere from the digestive tract, whether it's the small intestine or the mouth, due to poor dental care, things like that, you can get this leakage of endotoxic bacteria into the bloodstream. And there's a heavy association between having that in the bloodstream, and your body attacks that bacteria, and that releases endotoxins. Like, that's what your body's supposed to do. It's supposed to attack that bacteria, but it releases endotoxins, which are incredibly inflammatory, and they've been shown to damage the lining of the artery. We're getting this acute damage due to this acute toxin exposure. So that's another thing that creates that damage. But you can get prolonged damage too from many different lifestyle choices. And then, another, like the third thing that Virchow says is when the blood is too viscous. Like, we know that when things aren't, they're kind of sludgy, right? They're not moving through as well. It's more likely to have this clotting response, because that's what happens. So a clotting response is a normal, healthy thing, if it happens physiologically. But pathologically, if it's happening too much, it becomes a problem, especially in the lining of the arteries.
And this is the part I really wanted to zone in on, the clotting response, where in the way you see things, this is what happens when there's injury in the vessel, which is totally different than conventional thinking.
Exactly. Yeah. So, a clotting response is something that's supposed to happen. Again, if you cut your skin and you don't want to bleed out, so your body initiates a clotting response and stops that bleeding from happening and forms a scab. And if that damage to the lining of the artery happens so intensely in an acute situation, or it just kind of wears away over time from chronic inflammation, and then that the damage happens on the lining of the artery. And if that damage continues to happen and the body doesn't do anything about that, the artery is going to rupture. It's going to become so weak and rupture, and then you're internally bleeding. So the body initiates a repair response, which is the formation of clotting tissue. So you have all these clotting factors in your blood. I remember learning about all of them in school. They're like factor 8 and all these different factors, and fibrinogen and prothrombin and all these different things. And there's like this clotting cascade, they say. And you initiate that physiologically when it's supposed to happen, then that's a normal thing that we need, because there's normal wear and tear that needs to happen, or that has to happen, and your body has to repair it. But when it happens excessively or pathologically, because we have damage to the lining of the artery and our blood's just not moving well and it's too viscous, then it's just more likely that we develop this scab, basically this fibrotic clotting tissue on the lining of the artery. And then, like I said, if you can't heal that scab, you can't heal that damage, and there's still inflammation around it, it's just likely to build up and build up and build up. Or people have heard of like plaque ruptures, and the plaque can rupture, and there's lots of evidence that plaque ruptures very rarely, if ever, cause a heart attack, but they do lead to more development of that plaque building up over time. But it's all a clotting response, which that should tell us, though, the answer to preventing atherosclerosis is preventing a clotting response, not micromanaging your lipids, because we've seen what that approach has done. Statin drugs are the number one prescribed drug in the world. They're one or two, depending on the year, from opiate drugs. So they're very commonly taken, but heart disease is still the number one killer. So if we were having really an effect, then it would be more effective than that. We really should be focusing on clotting, and that's what the literature shows, very robustly, is that we should be looking at clotting factors.
Let's come back to your example there with the leg. You have this clot. When did you realize what was going on down there? Obviously, you're feeling the pain you mentioned when you're walking, but when did you get definitive data on what was happening, and then what happened from there?
That was about 6 months, well, maybe 5 months after I initially felt symptoms. I finally went in and got a Doppler ultrasound that confirmed that there was a 75 to 99% blockage of that artery in my leg. So pretty severe, right? And so just so people know, I'm also type 1 diabetic. And so this is called peripheral artery disease, when you get plaque development in your leg. And to me, it was due to this device. And so the studies on peripheral artery disease show that type 1 diabetics usually have worse outcomes than even type 2 diabetics for whatever reason. And so it was July of 2021 when I first got that imaging done. And so at the time, the vascular surgeon I went to see after that was like, well, we could stent it or we could bypass it or whatever. But he's like, it's only interfering with things you like to do. It's not interfering with your day-to-day life. So let's leave it alone, because usually when we mess with them, they get worse. And I was like, okay, cool. And so I said, I'm going to do my own thing, based on information that I knew at the time. I didn't know everything that I know now by far, but I knew some things. And so I did some different things. My diet stayed the same, which means my LDL level stayed the same. My stress stayed about the same. My exercise stayed about the same, although I wasn't as intense because I couldn't do that without pain in my leg. I could ride a bike though, without pain in my leg. And so all that stayed the same. What I changed was I increased my infrared sauna use. I bought a sauna and did that, got more sunlight exposure, did more grounding, and set my circadian rhythm. Those were the things that I changed. I'd never done those things like intentionally before. And in a year, I went back and got another ultrasound, and it was only 50% blocked. And the technician came back in and said, the doctor wants me to look at it again. We got a weird, a weird result. So they did test twice, and it showed it was only 50% blocked. And at that time, the vascular surgeon said, well, we can't say this is better because we don't see these things get better. Those were his exact words to me. And I was like, well, I mean, the testing just showed that it's better, but I didn't really say anything. I was just like, okay. So I went back and I kept doing the stuff, right? And then a year after that, I went back again and it was completely normal. And so then he said, well, come back in a year, we'll look again. And I said, okay. So I came back in a year, and that was the last May we had. And it was still normal. So my leg is normal now. I can run, I can hike, I can snowboard. And I have no pain in my leg, which is unheard of within Western medicine. That they say that that's impossible. I should not have been able to reverse that plaque. And I did. And I did so by using these modalities. And I'm sure we'll get into explain why those modalities were helpful as far as vascular health and allowing my body to reverse that. But just so people get a sense of how impossible Western medicine thinks that is, I was on X the other day, and I posted about this stuff. And there was this other influencer type doctor that was saying to me just something, and I said, well, hey, I actually reversed plaque in my body, and they were like, there's no way you did that. That's impossible. And I was just like, okay, well, and I posted my chart notes, my study results there, and he said you shouldn't read your own results. You should get a vascular surgeon read. And I was like, well, who do you think ordered these tests for me? It's a vascular surgeon. This is who interpreted this. And he was like, there's no way you did that. That's impossible. And I was like, here it is, So I don't know. I'm just stuck in that paradigm that's not possible. But what if it is? There's at least one example that it is. And so I think that I know the mechanisms by which I did that, or at least I have theories about how I did that. Because it's super important to figure that out,
Before we get to that, I want to fully set the scene here with your story. We've talked about the fact you're type 1 diabetic. You had this blockage in your leg, which you've completely reversed. We got to go back even a little bit further than when this blockage occurred. January 5th, 2021, you get done an exercise routine in the morning, and you have a massive heart attack. So take us back to that morning and what happened.
Yeah. So I've been interested in health most of my adult life, and I could always really control diet and exercise. And that's what I did. I was always really good about controlling that stuff. But yeah, I had a massive heart attack at 34 years old. Like you said, a widowmaker heart attack. So it was a 100% blockage of the left anterior descending artery. No signs or symptoms, no diagnosed heart disease before that. And I actually had a CAC score done, which is a measure of how much calcified plaque there is in the arteries of your heart. I had that done 6 months prior to this, and it was 0, which suggests I'm at very low risk for heart attack. It doesn't measure soft plaque, but it measures hard plaque, and a 0 score is pretty good. So anyways, this happened. And the reasons that I think it happened, because when I was in the hospital, they were like, oh, your cholesterol, it's cholesterol. I probably had 3 or 4 different doctors or attendings or residents while I was in the hospital. And I would ask all of them, because at this point I was like, hey, Tell me what you think, because, this is shocking to me. And it's what really pushed me even further down this path of figuring out what's going on. But yeah, their answer was very unsatisfying to me. And I was aware of a lot of the research on cholesterol and how ineffective statins are, and how the theory was not well founded by science. So I questioned that, and I was very disappointed with their answers. And it just really showed a lack of critical thinking, or lack of openness to different discussion, right? And so my best guess, which no one will ever be able to tell me exactly what happened, but when they looked at my arteries and when they went in to bust the clot and place the stent, they found no atherosclerosis anywhere except for the giant clot in the LAD. So my arteries were pretty healthy. And so what happened was an acute clot formed, like spontaneous acute clot that was large enough to block the whole artery. So you could get like chronically formed clotting tissue from damage to the lining of an artery that can form plaque over time. Or in my case, you could put yourself in a situation where it's an acute enough that it blocks the whole artery. And for me, what I think did it was, at the time, I convinced myself that it didn't make sense that our ancestors drank water all day long, so you didn't need to drink that much water. And so I was drinking probably about a cup of bone broth a day, which was unwise. I think I was pretty dehydrated. And I know I was dehydrated because I was dealing with a little bit of constipation at the time. And I hadn't quite convinced myself to do anything about it yet. And then I went through a period of higher stress. COVID was happening, and there were things I didn't like about COVID that was stressing me out. But then with all that happening, then a day and a half before the heart attack, I got very stressful news about a family member of mine. And it was the inability for anybody in my family or me to do anything for this person, get to this person, that was stressful. So Sunday night, I heard that news, didn't really sleep Sunday night. Monday was kind of this blur where I was trying to figure out if I could get to this person. Monday night, didn't sleep very well at all. Woke up Tuesday and said, I got to get my mind off of this. And I did a very intense workout, like you mentioned, first thing in the morning. Well, not first thing, probably mid-morning, where I would sprint up a hill, drop down and do push-ups to failure, do lunges to failure. My leg was fine at that point. That was the workout that I did where my leg was fine. And then 20, 25 minutes later, after the workout, when my body had calmed down, boom, I started feeling this pain right here in my chest. And at first it was somewhat mild. I thought my pec was tightening up. I was like, oh, that workout must have been intense. But it intensified. I started to get really flushed and hot, and my body just got super warm. And I was like, oh gosh, I went outside because it was January. It's cold outside, and it just wasn't going away. So I smartly called the ambulance. And yeah, we did the intervention, and that's what Western medicine is amazing at. In that situation, they saved my life, and Western medicine has saved my life 3 times now because of those types of situations, emergencies, right? And so, yeah, very grateful that they saved my life. But then after the fact, what they told me to do was very, very disappointing. Because like I said, I was like, okay, guys, what do you got for me? And it was just like a broken record, cholesterol. And every time I would ask them about the medications they wanted me on and why they wanted me on them, and they were just very not open to conversation about it. And there was like a cookie cutter recipe of this person's had a heart attack. This is what they should be on. And so, as an example, they said I'd be on 5 medications the rest of my life. 2 of those were blood pressure medications, a beta blocker and an ACE inhibitor. And I decided to take one of those for one day. I took 1 dose of it. And I remember waking up in the middle of the night, the nurse came in and checked my blood pressure, and it was 90/50, which is incredibly low. And so I was like, oh gosh, that's really low. And so then I was up and I realized that it was hot in the room. So I went to turn the thermostat down. When I stood up out of the bed, I almost passed out. I kind of went black and stumbled and fell into the wall a little bit. My blood pressure was really low. And that was only 1 dose of 1 medication. They wanted me on 2. So it was basically, again, this clear cookie cutter recipe. This is what you get, right? There was no critical thinking of, hey, this person has had normal blood pressure their entire life. Maybe it would be dangerous to give them 2 blood pressure medications. And I get what their reasoning was. I'm on those to prevent heart failure, which in my opinion, there's much better ways to prevent heart failure after a heart attack, which I did. But Yeah. So just lack of critical thinking. They also told me to eat a processed food diet. Like you should have seen when the nurse came in and told me what diet was best for my heart. Things like animal crackers and Fig Newtons and foods that were full of seed oils and things. Those were the heart healthy foods. And so I was just like, well, this is a processed food diet. This is not, I know what, the American Dietetic Association is funded by Big Food. I get that. I understand all that, but this is not what I'm going to eat, and so I quickly got reinvigorated, having this experience in the hospital, knowing that this was not the direction I was going to go. And I took a blood thinner for 6 months because of the stent in my heart. But after that, I'm on no medications. And I'm not saying that everybody should do that. I'm just saying that's what I chose to do based on my situation. And in 2 months, aside from having this pain in my leg, I guess maybe it was 3 months, aside from having this pain in my leg, I went back and got my follow-up echocardiogram. And I'd been using an infrared sauna at that point, not as frequently as I did after I got the leg diagnosis, but I was using sauna, and my heart had totally recovered. As far as the conduction signal of through my heart tissue, and my ejection fraction, which is how much blood leaves the left ventricle every contraction. It was at 35 or 30 to 35%, I think, which is normal is 50 to 70%. And after at that 3-month echocardiogram, it was 55%. So it was in the normal range. And so I went to, the cardiologist one time after this follow-up, and they said, "Oh, you must have decided to take your medications." And I was like, "Actually, no, I didn't." And I'm just an end of one example. But they was like, "Oh, well, you need to take those." And I was like, "Okay." So it was just like this. That was what they have for me, is you need to be on this protocol taking medications. And since that time, I have, even more than I had before, because I'm predisposed to heart disease as a type 1 diabetic, I've really delved into heart disease and atherosclerosis and heart attacks. And what I've learned has just completely blown my mind. And what I've been able to reverse and heal from, without following their recommendations, is, they say, unheard of and impossible. So I feel like I should share the information, at least, so people can make more educated health decisions, because I know they're not going to get this information from Western medicine. So,
given what you went through there in the hospital, you clearly mentioned that they saved your life. But afterwards, with the drugs, with the food, how would you recommend somebody going through a similar health crisis and being in that turmoil where decisions need to be made quickly, drugs are being offered, different foods being pushed your way? It sounds like, given what you just shared, you navigated that pretty well, and you have a medical background as a chiropractor, so you have that going for you, and you understand science, and you were already living a healthy lifestyle. But for somebody in that boat, or just a lay person, given that experience, how would you recommend they navigate that world? And obviously, with the caveat, everybody's got different situations, needs to make their own decisions. But what would you say do differently, and how would you guide somebody?
Well, I don't know that I would do anything differently. Looking back, I don't think I would do anything differently. I was very inquisitive of them, and just learned very quickly that they were going to shut down the conversation. The last attending that came in the day I got discharged said, "I'd never met this guy before yet," and he said, "Well, I'm not going to ask you about medications because I've seen that you don't want to take those, so I'm not even going to bring it up." And I was just like, "Well, maybe I'd be interested to know what you have to say. I haven't met you before, just get another person's opinion." But it was just shut down a conversation. Like, if I wasn't going to do the recommended, then it was nothing. And so I guess one piece of advice is that people who are more in the know, or maybe frustrated with some of the things that Western medicine does, the most important thing is don't get angry. Like, that's not going to help your situation. And so, yeah. But then also, I would say that in that situation, I was by myself. I had no support because it was during COVID and nobody was allowed to visit me. So I was just like on my phone researching like crazy. That's all I could do, sitting there in the hospital. But I would say that in that situation, you're scared, right? This thing happened to you, especially me. Like I was just like, how could this have happened? Like I've been very health conscious my whole life, and I've learned that diet and exercise is not going to prevent a heart attack. It's not going to prevent heart disease, and it doesn't in a lot of people. That's because it's a way more complex disease, and it has much more to do with environmental changes. But in that situation, you really have to try and not let the fear overcome you, because fear shuts down decision making. When your brain is in that fear state, you don't think very well. You want to be told what to do to get to a more safe situation. And it becomes a game in your head of really, controlling that fear so that you can think critically. And think that, this is just one person's opinion, this person in front of you. This is just one avenue of an approach you could take. And it may be the approach you decide to take. And that's totally fine, because ultimately what you do in that situation is up to you. It's not up to your doctor. It's not up to your spouse or any family members. It's up to you. It's your health and it's your body. And you have to decide what you want to do. If I was advising someone, even if they, felt like they needed to take drugs or do some things that Western medicine says, then that's fine. I would say, do whatever you want to do, but also do these other things that are actually going to create better health in you. And those are the things that I've kind of fleshed out and discovered over the last 4 or 5 years, as far as what's going to keep that healthy. And then I would also say that as soon as you're able, get out of that hospital, because it is the best place to be in an emergency and probably the worst place to be for healing. As soon as you're stable and it's safe to leave, get out. Because when you think about the EMFs in there, you think about the food they serve you, which is terrible. You think about, being indoors away from sunlight and under artificial light, how disrupted your sleep is. They come in 3 times a night and, take your vitals and wake you up. It's just like, if they understood what healing actually is, they would not do that. There's all these beeping lights and noises on in the room all night long. You're hooked up all this stuff, like you can't sleep at all. And it's just an incredibly, an environment that's incredibly unconducive to healing. And so as soon as you can, get out and start putting yourself back in an environment that will allow you to heal. Yeah.
You mentioned all the crap that they offered you food-wise, including crackers. Another layer on that, making that even more crazy, is the fact you are type 1 diabetic and you're somebody that's injecting insulin and needing to manage your blood sugar levels more than the average person, arguably.
Yeah. And that was another huge battle. That was the most stressful part of being in the hospital. So I'd forgotten that, but it's in the book, so I'm sure you just read it. It was incredibly frustrating because I'm type 1 diabetic. I have been since I was 9 years old. I didn't control my blood sugars very well as a teenager, but ever since then, somewhere in college, I got a hold of things. And, my A1C at the time in the hospital was 6.5, which is good for a type 1 diabetic. It's been lower than that before. And so that means I have very good control. Yet in the hospital, they refused to let me administer my own medications as far as insulin. And they would do it on this sliding scale where they would only give me insulin at meal times, and they would only do it based off what my blood sugar was and the food that I was eating. And if that didn't work, which it was not working, because my blood sugar was 300 the entire time I was in the hospital. And I was like, guys, I need more insulin. Like if what you gave me at the last meal did not work, I need to be more aggressive. And they were like, well, we can't do that. And I was like, well, let me do it. Give it to me. And they wouldn't give it to me. It was just the most frustrating thing, because here I am with proof that I can manage blood sugars on my own and they're not able to. And it was like, I'm supposed to be in this healing state and my blood sugars are 300. And so, eventually about a day and a half, I was only in the hospital for 3 days, but a day and a half in, my boss, brought a backpack to the front desk and they brought it up to me, and there was clothes and stuff in it, but he also put my insulin in there so I could manage it myself finally. That was incredibly frustrating. And it just goes to show that they really don't know what they're doing, right? For the most part, they don't know how to optimize things. They have a protocol they have to follow. And that may work in some instances, but it doesn't work in every instance. And there's no critical thinking. They can't, because they're afraid they're going to get sued. If I'm administering my own insulin and something happens to me, they're afraid I'm going to sue them, which I wouldn't. I don't care. So there would be no negligence there, but it's that fear in them that shuts down their decision making, and the protocols that they have in there that shuts down their decision making or ability to do anything. Is a big issue.
I think it's important you brought up that last piece about negligence and being held accountable to a certain standard, because in all fairness to them, the problem's even higher. It's the system that they're working under that handcuffs them basically into not being critical thinkers and just following protocols.
Yeah. And, even like when people go to a cardiologist or any doctor, really, you have to understand that they are somewhat bound to recommend what's the standard of care, and if they don't recommend that, or they don't chart that they recommended that, then technically they're liable. But what are they liable for? Well, they've been told, and the hospital systems have people on staff that tell you if you don't follow standard of care and you demonstrate negligence or whatever, that you're liable and your career is on the line, because if someone sues the hospital or sues you, you could lose your license, all this kind of stuff. And that's, to me, fear tactics. But they're operating out of fear again, which shuts down their decision making or their ability to critically think, what should I do for this patient? Well, I've been recommending this drug for 20 years and no one's ever really gotten better. Maybe I should do something different. You can't think that way, because that's the standard of care. You have to do that, or you have to at least document that you said that. And if you don't, you're programmed to think that something bad's going to happen to your patient and they're going to come back and sue you. And then the hospital gets mad at you, and then maybe you lose your job, maybe you lose your license. I don't know. But yeah, it's an unfortunate situation. And I kind of feel like, there's a lot of bad doctors out there, but there's a lot of bad of any profession out there. But I do think that ultimately the system works by the insurance companies, the pharmaceutical companies, and the hospital systems really feeding each other a bunch of money and creating a huge profit and feeding that. And then the doctors are stuck in that system, also benefiting from that system because they get paid very well too. So when you pay them that well and they are allowed to provide for their families very well, then the system's supporting them, and they kind of like, well, I like making this much money, and and so it's just kind of, they get stuck in that system with these standard of cares that make it less likely that they'll change and everything. And then the consumers, the patients, are here on the outside, and nothing's really ever, there's no benchmark that's saying we get paid well, we do better when the patients do better. It's all about the profit of the system. And even like the doctors and people in the system are incentivized by how much profit the medical system makes. They get kickbacks from that. They get paid more, bonuses, whatever. And so the whole system is set up that way, and the patients are left over here. And so getting back to that one question you asked me is like, what do you do in that situation? Is you just be educated on how that system works. Because if you're not, you may incorrectly assume that the people in there are really just giving you the best advice we have available, when in reality we don't. We have the advice that supports the system financially very, very well. And sometimes it's the right advice. Sometimes most of the time it's very wrong advice as far as what's best for a person to be healthy.
All right, I want to come back to the morning of the heart attack. You mentioned at that time no calcified plaque. You were under stress. You were potentially dehydrated. Talk more about the physiology of this spontaneous clot, because this is different than anything I've heard of before, where you're a healthy guy, no calcified plaque, and then all of a sudden you get this blockage out of quote unquote nowhere. What do you think happened there specifically?
Yeah. So if you look at the literature and you ask most cardiologists, interventional cardiologists, open heart surgeons, anybody, they'll tell you that the vast majority of the time, I've had one surgeon tell me that 100% of the time, heart attacks and blockages and things like that, whether it's a slow, gradual blockage or stenosis or an acute blockage, they happen in places where there's bifurcations or there's a turn in the artery. these places that create turbulent blood flow or interrupted blood flow. And so remember I mentioned that guy, Meyer Texan, back in the 60s, who was figuring out basically that poor stagnant blood flow was causing clotting to happen. So what he was saying is that if we have poor blood flow through an area, the body tries to build up the endothelial cells lining, trying to make a narrower space, and the artery can kind of constrict because, like if you put your thumb over a fire hose, it comes out more quickly, right? It increases the flow. And so that's what the arteries are trying to do, but it creates that proliferation that narrows the space, and that creates this proliferation that can become clotting tissue, but B, it creates a narrower space. So if there is thick blood or there's a turn, in the artery, it's just more likely that this blood starts to get stagnant. And that stagnant, like when blood is stagnant, so like if you get an injury to the lining of an artery, like let's say an acute injury, like just like if I cut my skin, that interferes with blood flow dynamics, right? Because now we got breaks in these tubes, or we got rough areas. And that interference of blood flow dynamics is what triggers that clotting response. And this clotting cascade has a clotting response. So to me, exercise is an inflammatory thing, and generally it's a hormetic stress, this kind of acute inflammation that results in a net positive because you train your body to be better. However, in a state of dehydration where there's more viscous blood, there's not as water in the blood, and in acute stress, which if you look at acute stress effects on clotting factors, like 9 different clotting factors skyrocket under acute stress, which makes sense because if you're perceiving stress, your body thinks there may be an injury. So it's getting ready to clot if there's an injury and stop you from bleeding. So my clotting factors were probably elevated. And then I did this inflammatory thing. That's this generally would be a good thing, but maybe not in that state, and then as soon as my blood flow slowed from the exercise, a clot formed, and it formed in the artery under the most pressure of any artery in the entire body, which is why we get plaque in the coronary arteries more commonly than any other arteries, because when there is things that damage the lining of the artery, like the stress I was going through, then it gets pushed up against the lining of those arteries more. And there's also a lot of bifurcations and turns, not bifurcations, but there's turns. They're very convoluted, those arteries. And so that's exactly where it happened for me. There's just one spot very near the very top of the LAD that has this turn in a lot of people. And that's exactly where it happened to me. So we had this acute inflammation, and there may have been inflammation to other places in the arteries too, but it just didn't result in a clot being triggered. And so that's what happened. Like that's the physiology. The blood initiates a clotting response. And in my case, it was large enough that it blocked the entire artery. But it could have just been enough that it created this little plaque formation on it, So, and if maybe I was more hydrated, or maybe if I was at the time, if I was under infrared light, or if I was grounded or something, maybe it wouldn't have happened. I have no way of knowing that. And maybe it still would have happened. But those are things that promote blood flow and adequate motion to the blood. So yeah, that's to me what happened. But again, no one will ever be able to tell me what really happened. Even then, just to kind of challenge people, because this is the way my brain thinks. It's like they go in there, do the heart cath, they go in, they're visualizing the arteries, they see this blockage, and they see that there's interrupted blood flow, and they see it on the angiogram. And they say, well, how do they know that blockage wasn't there prior to the heart attack? They don't, because this is the first time anybody's seen it, right? And there are mechanisms of heart attacks that happen with no blockage whatsoever. So how do I know it wasn't that type of heart attack? I don't, and no one does, and no one ever will. I do know, though, that it likely wasn't that type of heart attack, because when they intervened and they busted the clot, my symptoms went away. But I also know they gave me morphine. So maybe I just didn't feel anything because of the morphine. And my nervous system calmed down, and I stopped having that heart attack response. So these are all things I talk about in the book, like these different mechanisms that we could get heart tissue death. But I don't know that it wasn't those things, but it doesn't matter to me, because I know enough now to know that whether it was a blockage or a type of heart attack without a blockage, I know how I'm going to get up and live my life. I know what I'm going to do every day to put myself in a situation where I don't have that again. And up until now, it has healed arteries in my body. this is what I've been doing, so I'm going to keep doing that. And that device in my leg, it's still there. So if I stop doing these things, maybe that plaque comes back. I don't know, but I'm not going to try that out. So yeah.
Come back to that type of heart attack that somebody can have without any blockage whatsoever, because before coming across your work, I hadn't heard of that.
Yeah. So in medicine, they document these as they call them MINOCAs. So MINOCA stands for myocardial infarction with non-obstructive coronary artery, which means there's no blockage, but we have heart tissue death. So how could that be? And so there's this work of a guy named Giorgio Beraldi, who his research is largely ignored by the field of cardiology. But he basically shows that, a blockage of an artery, a gradual stenosis over time, or a plaque rupture are not really the causes of heart attacks. And we have evidence now. I mean, I have not been able to find a study that shows that treating that lesion, that gradual stenosis, with an elective stent, not in a heart attack situation, but an elective stent where there's no heart attack happening and they go and they place a stent, or a bypass surgery, is useful as far as preventing a heart attack in the future. Like, those procedures just don't work. Whether you have them or not, doesn't matter. You're just as likely to have a heart attack according to the studies. And so Beraldi's work showed us that those stenoses, they build collaterals. Like, whenever you get to about 60 to 70% narrowed of an artery, the body always builds collaterals. I've had cardiologists tell me that only some people do, but Beraldi's work showed that 100% of the time, and he autopsied thousands of hearts during his career, that they form the collateral arteries. So that's why the stents and bypasses don't really make a difference, because the body's already figured it out. But then he developed a theory, and there's others that have come up with this theory too, and there's lots of evidence to suggest that these steps do happen, of how we get heart tissue death when there's no blockage of blood flow. And it has to do with the amount of stress signaling we get to our heart. So the nervous system, people think of it as an autonomic nervous system that has two parts. It has a stress and a non-stress signal. And in reality, people think we're in one or the other, like we're in sympathetic or parasympathetic, but we're really never in one or the other. The body's always sending signals of both, and they're balancing each other out. So if I have a stress response and I get a surge of adrenaline and stress to my heart, then there's always supposed to be a lesser balancing signal of non-stress to balance things out. So people could think of it like this. If I'm walking my dog on a leash, and my dog has a stress response because it sees my neighbor and it wants to go after my neighbor, the dog has the response and it goes, right? But then I have a leash, and that leash is the non-stress response, holding things in place, stopping something catastrophic from happening. If the non-stress response is not there, there's no leash, my dog attacks the neighbor, I get sued, right? That's the catastrophic event. But the parasympathetic, the non-stress signaling, is holding that, keeping that from happening. So that's what's supposed to happen in the heart. However, we can get into a situation where that doesn't happen. We get a surge of stress response without the lesser surge and balancing non-stress response. And that non-stress response signaling, what's critical for it to get into the cells, the heart cells, is nitric oxide. So if you have poor endothelial function, poor artery function, low nitric oxide, higher blood pressure is a sign of that, or poor metabolic health could be a sign of that. Then that non-stress signal doesn't get into the heart as well as the stress signal. So you get this surge of stress signal into the heart cells, and the heart typically prefers to burn fatty acids or ketones. And there's tons of literature on that showing that even in the presence of glucose, which is peculiar based on the rest of the body, the heart will preferentially burn fatty acids and ketones because they're more efficient fuel sources, and the heart is always contracting, so it needs more efficiency. But however we get that surge in stress signal, it causes this increase of burning of glucose in the heart cells. So this is similar to like if you went for a run and your muscles start burning glycogen in your muscles. When you burn glycogen, you get a lactic acid buildup and a hydrogen ion buildup from burning that glucose, and that can create a muscle burn in your leg, right? We feel the muscle burn, and then we just stop running, and it goes away. The body gets rid of that lactic acid and hydrogen ion buildup. However, in the heart, if that surge of adrenaline happens, it starts burning more glucose, and we start to feel a little discomfort, which I think is what angina is. It's not this. It's not always a lack of blood flow to an area. It's the heart burning more glucose than it wants to. We build up that lactic acid, and that's a problem because the heart just can't stop contracting, right? Like we can just stop running and get rid of that. So what happens is that buildup of lactic acid and hydrogen ions creates this swelling in the heart tissue, and when there's swelling, the pressure from the inside is greater now. And so now the blood, usually the pressure is greater from the blood coming in, but when that swelling happens, the blood can't get in anymore. And that creates necrosis, tissue death. There's no oxygen, there's no nutrients to that area, and we get this area of tissue death. And in Beraldi's work, that one scientist, he showed that he autopsied people with heart attacks, and he showed probably, I think it was like half the cases over his career, that the heart attack people had, the tissue death people had, was in a totally different place than where the blockage was, right? So if it was because of this blockage restricting blood flow to an area, it would correlate with that. Now mine was that way. I did have a blockage, and the area where the tissue death was downstream from the blockage. But in many people, according to Beraldi's work, that was not the case. So these people likely had these Minoka type heart attacks. So it's interesting. This is way more convoluted than we think, and it also suggests an entirely different way of helping prevent that type of heart attack, which has to do with balancing the autonomic nervous system and optimizing our metabolism and setting our circadian rhythm. All this stuff that we could do.
I want to come back to something you mentioned quickly earlier: the fact that being a type 1 diabetic makes you more susceptible to heart disease. And when you went through and talked about your situation having a heart attack, you didn't bring that piece into being causative. So I'm curious if you think being type 1 diabetic was part of your heart attack or not.
It could have been in two ways. Again, there's no way of really knowing, but theoretically, yes, it could have been in two ways. So my blood sugars, no matter how hard I try, are never going to be as normal as someone without type 1 diabetes. Now, I know some type 1s who achieve definite levels of normalcy, but it's not the same for everybody. I know people that are doing the exact same thing as me, and their blood sugars are completely normal. They were usually diagnosed later in life. I was diagnosed at age 9, and I think there are different types of type 1. So my blood sugars are never going to be as normal, which means there is fluctuation, which has been shown to cause artery inflammation. So that could have been I was somewhat predisposed because of that. I already had this maybe low-level artery inflammation, especially with stress, which during stress, it's very hard to control blood sugars. But, I eat a pretty low-carb diet, and that makes it very easy to control blood sugars from my perspective. So that's one thing that could contribute. The other thing is that being type 1 diabetic, especially when I wasn't controlling things back when I was younger, the fluctuation in blood sugars can create more cortisol or stress response. And over time, that can lead to this imbalance in the autonomic nervous system, which we just talked about, mechanisms by which that can create issues. And there's some literature that shows that type 1 diabetics are less able to handle the stress response of, say, an intense workout, which is exactly what I did before the heart attack. So yeah, there are different ways that it may have contributed or kind of set the stage for me. And then the environmental factors pulled the trigger, right? So, but I don't know for sure. And all I know is that I got to keep living the way that I'm living and protecting the arteries the way I'm doing it. So yeah.
Let's come back to your paradigm and how you see cardiovascular health and how it differs from conventional thinking. And the part I want to zoom in on to start is this easy water piece. So we have our endothelium, we have the glycocalyx, and the way you see things, there's this other layer on top of that, forming another boundary with easy water. So let's go there.
Yeah, this is my favorite thing to talk about. So there are three things that I think, there are three major changes over the last 100 years or so when we saw this exponential rise in heart disease, coronary artery disease, plaque, atherosclerosis, that I think explain why it's happening, because like I said, it was rare in the early 1900s. And it has to do with changing our environment to an extent that has interfered with structured water formation. So what is structured water? So many scientists have discovered that water has a fourth phase that it can exist in. So we all know solid, liquid, gas, ice, water, steam. But it actually has this fourth state, and it's more like a gel. So you can think of like the consistency of raw egg white or Jello or whatever. It's kind of like that. And so, again, many different scientists have come across this over the years. So it's got many different names. It's called structured water, exclusion zone water, fourth phase water, bound water, different things. And so the most compelling evidence to me that most of the water in our body is in this gel state is the fact that I feel like a gel. You know, if I push my forearm or my thumb down or whatever, like the tissue gives and it bounces right back. Just like if I was pushing Jello, it would give and bounce right back. And so they have shown in the lab of Dr. Gerald Pollack and many other scientists have found that there's this cell-free layer next to the lining of the artery that no red blood cells or anything really penetrate, that's right next to the lining of the artery. So if you just go into the Google Scholar and type in cell-free layer, you can read all the articles that come up that show this. And they didn't know what it was for a long time. But Gerald Pollack and his lab at University of Washington has really delved into the structured water piece of it. And so what happens is that when water holds energy, which water has this unique ability among liquids to hold energy, and when it does, and it gets next to a water-loving surface, a hydrophilic surface, which all biological surfaces are water-loving, then it will actually change its structure a little bit. So what happens is water is an oxygen and two hydrogens, and one oxygen and hydrogen come over here, and one hydrogen is cleaved off, and those oxygens and hydrogens that are left team up with other oxygens and hydrogens, and they form this lattice-like structure, that kind of this hexagonal structure that forms like this planar-like surface, and this is why it's structured water, so to speak, because it has this structure to it, but it's not rigid like ice. And so it lines up next to hydrophilic surfaces and it forms like this stacked area. So there's like this layer of gel. So now this water has some unique properties. One, the reason that it's called exclusion zone water is because when it forms, almost nothing can penetrate it. So it excludes anything that's not it, has an exclusion zone. The only things that can penetrate it are very small hydrated ions of minerals. Including the precursors to nitric oxide, which come from the lining of the artery, and they can get through the structured water and form nitric oxide. But in Dr. Pollack's book, he notices that albumin, which is the smallest protein in the blood, cannot penetrate it. And it's like 1.8 nanometers in diameter. So anything larger than that is not going to touch the lining of the artery if we have healthy structured water there. And so lipoproteins are way too big. Red blood cells are way too big. And the only thing that's small enough is anything potassium ion, hydrated potassium ion or smaller can penetrate the structured water. So remember back to Virchow's triad, he told us what causes clotting. He told us that damage to the lining of the artery, poor stagnant blood flow, and elements of blood being too stuck together are what cause clotting. And that still holds true in medicine today. That's still accepted as what causes clotting. And so if we want to protect the lining of the artery from damage, we build structured water because nothing can penetrate it, right? So that's the first thing. The second thing is that in Dr. Pollack's lab, they've actually shown that when you build structured water, so structured water was a balanced molecule because it had two hydrogens and an oxygen. But now one of the hydrogens is gone, and so the structured water becomes a very electronegatively charged substance, right? Because the oxygen is a bigger molecule. And so you have this negatively charged area, and those hydrogens that were cleaved off are concentrated into the space next to it, and that's a very positively charged area. And a positive next to a negative is a battery, which is why we have positive and negative ends on a battery. And they've actually done experiments in his lab where they form structured water, and they plug an electrode into the positive and negative end, and it powers a light bulb. So you can create energy from this. And so they've also shown that you put a tube made of a hydrophilic solution or hydrophilic material into a water bath, and you shine infrared light energy onto the water, and the water starts moving through the tube with no pump acting on it whatsoever. So the energy created by structured water does the work of moving fluid. And they've actually proven that this happens in chick embryos. They stopped the heart of a chick embryo and they shined infrared light on the vascular system, and the blood continues to move with no pumping heart. So this is really how the blood is moving. It's the main way the blood is moving. The heart does do a small amount of pumping, but it is not responsible for the movement of blood primarily. And so that's Virchow's triad number 2, is have adequate blood flow. And so infrared light building structured water creates this adequate blood flow. The third part of Virchow's triad is elements of blood being too sticky. So they've also shown that structured water forms on the elements of blood. The red blood cells, the lipoproteins, have what's called this zeta potential. And the zeta potential is just a negative charge that surrounds the red blood cell or surrounds the lipoprotein. And things that have like charges repel each other. So if everything holds their negative charge of structured water around it, they're never going to clump together, right? And one of the biggest risk factors for heart disease is what's called an ESR test, which is a measurement of how likely that your red blood cells are going to stick together. And if you build structured water on them, they're very less likely to stick together. And so that keeps the blood very thin, so to speak, less viscous. And we're keeping the blood thin, not by interfering with clotting factors like a blood thinner does, but by building structured water on the arteries. And so that's Virchow's triad number 3. That's how we prevent clotting, right? And we build structured water in the arteries. So what's the number one thing that builds structured water? There's lots of things that do, but the number one thing is, based in Dr. Pollack's lab, is infrared light exposure. And the reason this makes sense is because the sun, anytime it's up, is 40 to 50% infrared light. So humans and all life is supposed to be outside. So what has happened over the last 100 years? 3 things. Those 3 things are, in the 1950s, we invented fluorescent light bulbs. So we went away from incandescent, which are high in infrared light. And we were also using fire before that, and sunlight. We were outside a lot. So we moved indoors under this bright fluorescent light, which is void of infrared light. So we compromised our ability to make structured water. And that's the protection from the clotting that is atherosclerosis. So that's step number 1. You remove the protection, or at least decrease the protection, because of our lack of exposure. Second thing is we added in all these toxin exposures and processed food diets. That's what happened in the 50s. Right? We started having this processed foods and all these different ingredients. And even before that, seed oils were added like in the early 1900s. So that didn't help. So then we added insult. We removed the protection, added the insult. Now we're getting inflammation to the lining of the artery, damage to it. And we're also not getting very good blood flow because infrared's not there creating the blood flow in the structured water. The third piece is, once we've caused the damage, we created an epidemic of diabetes. And insulin resistance and poor metabolic health, really, which can be present well before you're diabetic. And insulin signaling and melatonin levels are critical for the healing of the artery once the damage has happened. So if you interfere with those things, you take away the protection, you add the insult, cause the damage, and then you interfere with the body's ability to repair it, you get this epidemic of cardiovascular disease, which is the number 1 prevalence and number 1 cause of death in the world. Is cardiovascular disease. And that's exactly what's happened. It's a combination of all those things. And so when you think about it like that, and you learn about what else is in the blood, looking at lipids and trying to micromanage a lipid panel sounds ridiculous. And it is. And this is where it's gotten us. You know, heart disease is still the number 1 killer, even though people are taking all these statin drugs and everything, because they're totally ignoring the actual causes of heart disease, which is basically low energy to the body and lack of structured water formation.
All right, so we want structured water in the body. 3 main reasons: the triad protects the vessels, it keeps red blood cells from clumping, and it promotes healthy blood flow through the body, correct?
Mm-hmm. Yep.
Talk more about the blood flow piece and the heart not being the primary mover of blood. Again, reading your book, this is one of the things that was new information to me. It's assumed in conventional medicine that the heart is contracting and pumping blood through the arterial system and the venous system. You've brought in this other piece, but you also did say that the heart does contribute. How much would you say the heart is contributing versus this easy water piece?
Well, I don't know about exact ratios, but it's a very little amount. So the heart does do some pumping, but it's really no more than enough to move the blood through the chambers of the heart itself. And the reason, so we'll talk about the reason the heart is there too. But the heart is not a pump in a sense. And if people go back and listen to the first part of this whole thing, they'll probably realize that I never referred to the heart as a pump. I always said the heart's contracting, not pumping, because that's what I firmly believe. And there is a whole host of literature on this subject. There's a whole book called The Heart and Circulation, written by Dr. Branko first, that reads like a 200-page research paper with tons of citations about how we have so much evidence that the heart could not contract strong enough to pump the blood throughout the entire body. And in school, we learn things like, the one-way valves in the veins prevent it from coming back, and the movement of your muscles helps the blood move. But if you look there's studies that show, if we look at the heart as a pressure propulsion pump, a pump that sucks in fluid from somewhere and forcefully pumps it out somewhere else, the amount of energy that it uses based off how much fluid moves through it, or it moves, quote unquote, it's only about 15 to 30% efficient, which, whether you believe we evolved or we were created, that's not a very efficient way to create something whose job is to move fluid, right? And so it can't be the main mover of the blood. So, and also just logically, if I was going to pump blood from my toes to my head or to my chest, I wouldn't put the pump at the top of the hill. I'd put it at the bottom and pump it up, right? So it doesn't make sense logically, but also, like, we have to ask ourselves, how does water get from the roots of trees up to the leaves? There's no heart in a tree, so it has to move by different mechanisms. And in Dr. Pollack's lab, they've shown that in tree roots that this structured water formation happens, and it moves water through the tree roots and up against gravity, so to speak. So there's no way that the heart could be the main mover of the blood. And in fact, there's evidence that when the heart is being forced to be more of a mover of the blood, it's because these other mechanisms are broken down in the body. And that's when that's one thing. It's one small part of what can develop heart failure. The heart is being forced to be more of a pump than it's supposed to. So if the heart is not the main, we've shown and we've talked about the mechanism by which blood does move. And so the heart actually operates more like a hydraulic ram, which I didn't know what that was when I first read that. I was like, what's a hydraulic ram? So I had to go to YouTube and learn what a hydraulic ram was. And the heart's actually two hydraulic rams put together, the left side and the right side. And so a hydraulic ram is a mechanism that is flow activated. So it has to have something flowing into it to be activated and to function. And there's a few differences between the heart or one side of the heart and a hydraulic ram, but they're minor differences. So in a hydraulic ram, water is flowing down into something from gravity, and then it fills up one chamber. And then when it fills it up, it closes a valve, and that creates increased pressure. And then that pushes another valve open. And then when it pushes that open, the water flows into the next chamber. And then when it flows up into that chamber, it flows up so much that it fills up, and the pressure created by that filling up closes the valve again, that valve that opened to let it in. And when it creates that pressure, it flows out another valve. And that pressure that's created, that it pumps it out, sort of. It's a hydraulic ram pump, but it's flow activated. There's no force, right? And engineers, can tell you how hydraulic rams work better than I can. But I compare the analogous structures of a heart, or one side of the heart, and the hydraulic ram in the book. And there are two differences. One is the heart doesn't have a spill valve in the first chamber. And instead of pressure building up and pushing back, there is a contraction of a ventricle that provides that little push. But again, it's just enough to push the fluid out of the ventricle itself. And then once it gets back out into the arteries, the structured water mechanisms pick it up and it moves it along. There's even actual evidence that the blood has some magnetic properties. And so when a valve opens, there's actually more of a suction happening out of the ventricles. It's not if it was a pumping thing, we would see the aorta, which is an arch. If it was a pump like that, we'd see the aortic arch expand. Just like if I had a hose that was coiled up on the ground and I forcefully turned on the hose would like unravel, right? We don't see that. When you look at angiograms and visualization of the aortic arch, when the heart is supposedly forcefully contracting, it actually curls up like this, like there's a suction happening. And that's what happens, is that because of that magnetic attraction, when the ventricle valve opens, it sucks the blood out of it, and you're creating this contraction effect of the aortic arch. And so, yeah, so that's how the heart works. It's this hydraulic ram pump, so to speak, but it has to be flow activated. So if the flow mechanisms are broken down, like if we're not getting enough structured water and we're not grounded and we're doing things that interfere with blood flow, we have a lot of bound up fascia in our body, those types of things, then the blood is moving more stagnantly through the heart, and the heart's being forced to be more of a pump than it's supposed to be. And that puts a lot of strain on the heart. And it's one thing that can contribute to the development of heart failure, where instead of the heart contracting in a spiral like nature, it starts to balloon out and become this basketball shaped thing, this cardiomyopic situation. So the heart is not a pump. There's plenty of evidence to suggest that. And so what is it then? What's its purpose? And in my opinion, there's 3 different roles of the heart in the body. None of them are to forcefully move blood. One is, another way that we energize water is by vortexing it, which means swirling it around or swishing it around in some way. And this makes sense because in nature, water is always moving. It's always being swished around. It's crashing on the beach. It's being evaporated and precipitated. It's flowing in rivers. Nature is not keeping water stagnant, and if it does get stagnant, like in a pond or a puddle, it gets dirty. And it's not really, it's like builds bacteria. So water is always supposed to be moving. However, when you move it through pipes, like in our blood vessels, it doesn't get swished around very much. So you have to insert a mechanism into the middle of those pipes, which is a peculiar place for a pressure propulsion pump would be in the middle, because it's not a pressure propulsion pump. And it's there to mix up the blood pretty much. It's a vortexing hydraulic ram. And that's exactly what we see when the blood is flowing into the heart. It flows in like a vortex, kind of flows in like that. Kind of like when you drop one of those quarters in those things and it goes around like that. It flows in like that. The heart is actually one big band of muscle that's wrapped up on itself. So when you unfold it, it's this one big continuous band of muscle. You wrap it up on itself, and when it contracts, it spirals like this. And so it's vortexing the blood. Also, when the blood flows out of the valves, it's eddying on both sides. So it's just creating this disruption of flow to vortex the blood and energize it in the presence of oxygen. So there's no mistaking, or there's no coincidence that the blood comes into the heart, gets vortexed, goes to the lungs, comes back to the heart, gets vortexed again, to get more in the presence of oxygen. And then so that when it gets out to the bloodstream, it is more energized so that it can form the structured water and create blood flow. So in a way, indirectly, the heart is responsible somewhat for the flow of blood, but it can't do it itself. It needs the right environmental stimuli to do it as well. So we need infrared light and grounding and things. And so that's the first role of the heart. The second role of the heart is that in times when we exert ourselves, the tissue demand for oxygen and nutrients is so high that if the heart wasn't there to actually slow the flow of blood, all the blood would rush over to the arterial side, and the venous side wouldn't have enough pressure and it would collapse. And so the heart is actually slowing the flow of blood in exertion. And there's some very eloquently done studies showing this in endurance athletes, that indeed, whenever they're exercising, the heart is kind of a damming up organ. It's stopping the flow of blood. So people think, like endurance athletes have this hypertrophic heart. The heart can get bigger in size and muscle. And it's actually because they've shown that it's better at stopping the flow of blood than forcefully pumping it. So it's kind of like a bigger catcher's mitt, to catch the flow of blood and then, vortex it. So it's there to stop the flow of blood during exertion. And then the third aspect of this, or the third role of the heart, is that the heart has the highest electromagnetic field of any organ in the body. It's letting off this electromagnetic field. And so all organs let off this field, and organs with the highest amount of mitochondria let off the biggest field. So the eyes, the brain, and the heart have similarly high amounts of mitochondria. So why is the heart giving off the biggest electromagnetic field? It's because there's evidence that when you vortex, when you spiral something in an electromagnetic field that's already exists, it amplifies the field exponentially. And so because the heart is the moving organ that's spiraling in our body like this over and over again, it's amplifying that field. So researchers have detected this electromagnetic field from, I think, up to 16 feet away. And so it's the organ that we reach out into our environment with, which is why we attribute all of our emotions and our feelings and everything with our heart. We feel things with our heart because it's what's allowing us to connect to other people's field and also connect with the environment around us. It's measuring coherence in the body. So it's measuring how synced up and communicating our body is, and all of our cells are signaling. And it's a sensory organ. It's sensing our emotional state and relaying that information to the brain, which is why we say, I love you with all my heart and not I love you with all my brain. So it's an incredibly fascinating organ that I don't think we fully understand. And it's incredibly important to understand if we ever want to tackle heart disease.
Coming back to the first purpose of the heart, the vortexing, gets me thinking about structuring water outside the body before we drink it. And there's a number of different devices. There's devices that spin water and create a vortex. There's wands you can use in your water. There's all kinds of different devices. So given the importance of structured water, and you've talked about getting sun and grounding, ways we can enhance the water already in our body, what about water we're going to ingest and using some of these modalities beforehand? Any value there?
Definitely. So, in Dr. Pollack's lab, he's shown that the toxin, the herbicide glyphosate, directly interferes with structured water formation. So, having clean water, and I imagine that's not the only toxin that would do that. It's just the one that he's tested. So having toxin-free water is very, very important. So getting rid of the toxins in your water, adding minerals to it, because the hydrated ions of minerals, they're hydrated, they're kind of the structured water formed around those minerals. So adding minerals back to the water, and then yes, you can treat it in some way, so to speak, or energize it, I would say, because I would argue that you can't really drink structured water because it would technically be in a gel state if it was structured water. So you can't really drink it. It'd be like trying to drink Jell-O. But you can energize the water. So then when it gets next to a biological surface, it, more readily structures itself. And so, yes, you can vortex it with these different devices that will do that. The most low-tech way to do it is get like a little wine glass and just swirl it around, if that's all you can do. It's better than nothing. You could put it in the sun, put it in contact with the earth. I know some people have like these little PEMF pads that mimic the electromagnetic field of the earth or something similar, and they put it on that. There's ways that you can create energy or coherence to the water so that it's more likely to structure itself when it gets in use. So I think that it is worth doing that. But also remember that if you don't have devices that will do that, there's low-tech ways to do it. You can put it in the sun, or you can drink clean, mineral-rich water and then put your body in the environment that helps structure the water. Because I think that hydration for the vascular system, like drinking water for hydration is important for the vascular system. But full body hydration, I think, is more about metabolic health, because mitochondrial function or optimal mitochondrial function, you're creating metabolic water in the cells. So if you have poor mitochondrial function, you're dehydrating your cells. But I think for the vascular system, drinking water is important for maintaining hydration in the vascular and lymphatic systems and things like that.
You mentioned PEMF mats. Using one of those or one of these mats that you can plug into your outlet and it connects to the grounding part of the outlet, how do those compare from your research to going outside and actually putting our feet on the grass?
Yeah, nothing's going to be as good as going out onto the earth and putting your feet directly on the earth as far as like conducting electrons from the earth. And a PEMF mat is just different frequencies that are trying to mimic or be more compatible with the electromagnetic field of the earth, the Schumann resonance. So both of those things, you're in contact with both of those things. We're in contact with it right now, even though my feet aren't on the earth. I'm in contact. I'm in that field, but I'm closer to that field if I'm on the earth. And I'm in direct contact with it, conducting electrons if I'm in contact with it. My feet are on a grounding mat right now, because when I am indoors, and I can be grounded, I try to be. So I have grounding sheets, grounding mats. I don't know that anybody's ever looked at compared to like how much I'm conducting, with feet on the earth versus a grounding mat. And I'm sure it would be different for different homes. But yes, they definitely work. Lots of the studies on grounding were done with grounding mats inside, and they saw physiological effects of reduction in inflammation and blood flow and increased theta potential on red blood cells with those mats. So, but I always default to the original way it was done. I think that's always going to be best.
And for somebody that wants to go stand in the grass or use one of these mats if they're on their computer, anything we need to be aware of when it comes to, say, underground wiring or being close to certain structures that are emitting electricity into the ground? Basically, what do you look for when you're grounding to make sure that ground is safe and health promoting?
Yeah, so I wouldn't, if you knew, I wouldn't necessarily ground on an area where there's big power lines underneath you. I don't know that would be necessarily less harmful or more harmful. I mean, but it doesn't seem like it would be, like it's interfering with some conduction. But I have heard some theories that being grounded actually protects you from electromagnetic fields in some sense. So yeah, definitely being in like submerged in natural water, that's very protective against, you're very grounded in that state, and that's protecting you from EMF. But then there's things like dirty electricity. So dirty electricity is basically this crazy EMF field, and all these different electricities coming from all these different places can kind of find its way into the wires in your home. And since there's AC current in the home, it's kind of this pulsating thing. And so if you're worried about that, you can buy dirty electricity filters that you can plug into the wall that kind of eliminate that dirty electricity, cut off the circuit, so that when you plug in the grounding prong, you're not worried about getting any of that through that wire, because the grounding prong is not wired to any electricity. It's just going to the ground. But it's a wire that's conductive, so it can absorb some dirty electricity if it's around. So if you want to avoid that, you can get those filters. But my home, I've had it tested by a building biologist, and they said dirty electricity wasn't that big of a deal. So I don't worry about it too much, like right now with the grounding mat that I'm using. But when I sleep at night, I turn off electricity to the bedroom altogether, and then the grounding sheets are plugged into the wall. So I'm not worried about it at all at that point. But yeah, there are concerns sometimes, especially older homes, I'd say, that may have some, poor wiring, or areas like in cities where there's lots of EMF and different electricity everywhere, those can be concerns. But yeah.
All right. So going over the areas where you're grounding: bed sheet, at your computer. Right now your feet are grounded. Do you have any other grounding mats throughout the house?
No, I just have one, and it kind of follows me around the house. And then I go outside as often as I can. But that's the other thing too, is like, on grass or dirt, you're very grounded. But also if you have like a concrete patio that's maybe 4 or 5 inches or less, and it's directly on the earth, you're conducting through that somewhat. I have a little grounding tester that I can test if my circuit is complete, right, with the earth. But also the leaves of a tree, you can touch the leaves of a tree and you're grounded. Patio stones, those types of things. The beach, the sand. Places that are not grounded are asphalt, mulch, dead wood, not very grounded, not conductive. Places like that. So yeah, but as much time as you can spend feet on the earth, it's a good thing.
All right. So number one is getting your feet right on the earth. If somebody wants to be more prescriptive with this, how much grounding is ideal? It sounds like you're doing quite a bit with your hacks indoors. But now that we're moving into the practical, how much would you say is a good amount to aim for per day?
It's hard to say. I don't know that anybody's really measured. Well, I do know like of self-experiments where people will look at their live blood analysis, and they'll like look at it beforehand, and their red blood cells are clumped together. They see this rouleau formation on there, and then they'll go out and do 30 minutes of grounding, and the red blood cells are perfectly evenly spaced after that. And then about, I'd say, an hour after grounding, when they've stopped grounding, they're back to being fairly not as bad as they were to begin with, but they're pretty clumped together. Now, that's just the end of one experiment, and I also don't know much about that person's, like, what environment they went back into after they grounded. I don't know if there's like a high EMF environment or whatever it was. But so that gives people a sense of like how long that's going to last. You got about an hour if you spend 30 minutes grounding to where it's going to go back to a more coagulative state, so to speak, which is why the indoor grounding tools are useful, because I can be grounded as much as possible. Even if it's less of a conduction than outside, it's still something. And grounding sheets are very useful because I can be grounded all night long. So yeah, and then minimizing your exposure to things that have been shown to steal the charge, break down structured water. So wireless routers have been shown to do that. Artificial light is very confusing. We want the infrared light. That's very building the structured water. So I have incandescent bulbs in the house. If I am using light bulbs, I try and be outside. Red light panels, infrared sauna. Like, I try and boost my infrared exposure so I don't have to live outside, necessarily. But I spend my time outside as much as I can, But yeah, it's doing those types of things.
When it comes to infrared saunas, I know there's near infrared and far infrared. I personally have a far infrared at home. From reading your book, I know that sweet spot for creating structured water is 3,000 nanometers. Is that part of the far infrared spectrum?
Yeah, it's far infrared. Yeah, so that's the farthest wavelength of infrared that would come naturally, right? So that's what they tested in Dr. Pollack's lab, that farthest wavelength. And so it's basically the spectrum of electromagnetic light. So you have infrared through UV. That's the only light that we're ever supposed to get from the sun. All this other artificial light, whether it's wireless signals or the blue light, whatever, it's either processed light or it's outside that spectrum. And so UV also makes structured water, but it was the least efficient. And then the far other side of the spectrum, the far infrared, was the most efficient at building the structured water. So that's why I have a far infrared sauna. And the sauna I use, it's been tested, and it's as far as I know, which I don't know everything about every sauna, but as far as I know, it emits the most far infrared light of any far infrared sauna out there. It's the one I use to reverse the plaque in my leg, or the one I use while reversing the plaque in my leg. So yeah, technically I would think far infrared is the best for building structured water, but near infrared will do it. Red light will do it. All the wavelengths of light will do it, aside from processed blue. Like, so, there's this discussion to have. People will tell me all the time, like, well, if processed light is bad, then a far infrared sauna is processed light. It's one wavelength. It's always supposed to be balanced with all the colors and wavelengths. And I was like, you're exactly right. And if I was to overuse that processed light, then I think it would be harmful. If we had chosen red light or infrared light, which is not visible, so we couldn't light our homes with infrared light. But if we had chosen red light to light our homes, I think we'd all be talking about the harms of red light at this point, but it didn't make sense because red light's not that bright and didn't really make sense to do that. So we're talking about the harms of processed blue light and light that is very high in blue, because like you can look at, there'd be a threshold, like, and you do like the red light laser therapies for like treatment of scar tissue and things like that in your body. Like it's like beneficial, it gets to a certain point and then it's negative. So if we overdid this, I think it would be harmful. But the reason it's seen as a therapy, these red light panels, near infrared, far infrared, is because we're so deficient in infrared light, because technically we're supposed to be outside during the day, exposed to it all day long. Even if we're in the shade, we're getting infrared reflecting off the grass and stuff. And so we're just so deficient in it that it seems like a therapy. And I think an important therapy to use if you can't be out in the sun all day long. But I think that if you look at all the statistics and the trends in diseases, every disease gets worse in the winter. We have worse heart attacks, worse deaths from cancer. Every disease gets worse. And when you think about the fact that it's harder to get outside, there's people just get less sunlight in the winter, depending on where you live, then it makes sense. Like, we're getting less structured water, which plays a role in every chronic disease. And that's causing an issue when in the winter, among other things. We also eat a bunch of processed food around the holidays and all this other stuff that we do. But that's one contributor. So, yeah, that's the light story.
Okay, so far to build structured water, infrared light, grounding, What other areas do you try and hit on within a day?
Infrared light and grounding are the main ones we have removed ourselves from in our modern way of life. So those are the main ones to add back. But then, like I mentioned, there are things that tear down structured water. So we have the wireless signals. In Dr. Pollack's lab, a wireless router, just a normal wireless router, interfered with structured water formation, 15 to 20% reduction. So we're inundated with these signals these days, and you're never going to get rid of them all. But it's important to mitigate them when you can. Stay as far away from them. So like the closer it is to you, the more harmful it is. So keep it as far away from you as possible. Put the wireless router somewhere else in the house. Don't put your cell phone next to you. Like don't use a bunch of wireless headphones and all that kind of stuff if you can avoid it. And then eliminate it when you can, like when you sleep. Like you don't need it, turn it off. I sleep in an EMF blocking canopy that gets rid of all of it, all the cell towers and everything from around me. So yeah, you can go as far down that rabbit hole as you want. So that, and then I mentioned toxin exposure before. Those things, toxins have been shown. I mean, it makes sense. So anything that we think of that causes oxidative stress, something that's trying to steal an electron from somewhere because it wants to be paired with electrons, these free radicals, anything that can do that, well, guess what? A very robust amount of electrons is stored in structured water. So if you have this oxidative stress, a lot of these molecules like toxins or reactive oxygen species from damaged mitochondria, things like that, poor metabolic health, then you have a lot of these things that can potentially steal energy from structured water and break it down. So that's an issue. So anything like that. So, and like I said, it hasn't been directly tested, but I wouldn't be surprised if heavy metals and plastics and herbicides and pesticides and all these different things all steal the body's charge of structured water and break it down. So that's the other thing, is removing the things as much as you can that tear down structured water.
And the good news within this is a lot of the things you're talking about to build structured water and to protect against breaking our structured water are things that are part of what people in our world know as a healthy lifestyle. It's just looking at it from this other angle of why those things might be helpful, because they're acting on the water in our body.
Yeah. So if you take a big picture, right? This is ultimately what I've come to like discover or think, is that life is it's all about harvesting energy from the environment and using it to create order. So the universe abides by the laws of thermodynamics, which is energy is never created or destroyed. It's only passed between two things, and that things with concentrated energy tend toward disorder, entropy, right? And so what life is harvesting energy from the environment and temporarily defying the second law of thermodynamics, and maintaining order in a system, in an organized system, while that thing is alive. And then once we die, it dissipates again. The energy dissipates. But while we're alive, we want to maintain that order. And if you don't have enough energy in the system to maintain the order, you get disease. Things start to break down. And so the first place that seems to lose its order, or the body seems to sacrifice, is the lining of the arteries, which is why when we put ourselves in a situation that has deprived of our energy sources, infrared light, grounding, and then we've added these things that steal those energy sources, then the vascular system is what suffers the most. And that's why we have an epidemic of cardiovascular disease in this country, especially in America. But so we have to put our body back into a situation where it can harvest energy from the environment. People think that we get all of our energy from food, and that's absolutely false. There are scientists that estimate we should only get about a third of our energy from food, and the rest should come from our environment. And we have the ability to conduct electrons, which is what we're harvesting in the chemical bonds of food. We're trying to take the electrons from them and put an electron transport chain and make ATP, which is not the energy currency of the cell, but it's very important anyways. That's a different conversation though. And so we're trying to get electrons from the environment, and you can conduct the electrons directly from the earth, but we also have DHA and melanin in our skin that takes sunlight and convert it directly to electrons. And these processes are there for a reason. And so if you live inside all day out of the sunlight, you're depriving your body of those electrons. So if you don't give your body energy, don't expect it to be able to maintain order. That's basically the big picture fundamental understanding of it.
All right, we got to come back to the ATP piece. You mentioned quickly there the fact that it's not the energy currency of the body, which science has it's a common understanding within the scientific world that it is. Talk about how you see that.
This is something I discuss in detail in my most recent book I came out with back in August. It's called Pain Sense, where I talk about the chronic pain epidemic. But yeah, there's this, we're all taught in, 8th grade biology that the goal of the mitochondria is to make ATP, and ATP is the energy currency of the body. However, there are issues with that in that this one scientist, many scientists actually, but mainly this scientist named Gilbert Ling, experimentally and mathematically proved that I don't care how many mitochondria you have in a cell, there's no way that it could make enough ATP to power just the sodium potassium pump, if the sodium potassium pump even exists. And he was like, there's just no way to make that much. And especially like during cell division, that's said to take up 40% of the cell's energy to do that. How is it supposed to do that if we can't even make enough to power the sodium potassium pump? And it's because energy is stored in ATP. There is an energy bond in the chemical energy bond that is storing energy in ATP. But all it's really used for is to unfold proteins in the cell. So, think of so what does structured water need? Like all of our cells are made of structured water, right? That's why we feel like a gel if I poke myself. And what structured water needs is energy, an energy source. It needs surface area, right? It needs a spot to a hydrophilic surface to deposit itself on and become structured water. And so if you roll up a ball of tinfoil real tight, that's a very small surface area. But if you unfold that tinfoil, you create a lot of surface area. And so ATP's job, the reason we pass electrons down electron transport train and then pass hydrogens the other way and go to complex 5 and make ATP, is so that those ATP can unfold proteins. Because when they unfold proteins, water structures on it. And that's where the energy for our bodies is held, in structured water. It's very electronegatively charged. So when you think about building structured water, you're charging your body like a battery. Remember, I told you structured water creates a battery. It creates this thing that does work in the body. And so that's where it's being stored. So ATP is still critical because we need surface area to build structured water. But it's not the energy currency of the cell. And then further from that, there's Gilbert Ling also has his association induction hypothesis, which basically explains that, because they've done experiments where you remove the cell membrane of a cell and the solute distribution. Anybody who's familiar with cellular physiology knows that the potassium is concentrated inside the cell and sodium is concentrated outside the cell. And we talked about how exclusion zone water excludes anything that's sodium or bigger and includes and things that are potassium and smaller can get in, right? And that's exactly what we see. Potassium and chloride are inside the cell and sodium is excluded outside the cell. And when they did experiments where they removed the cell membrane, it stayed exactly that way because the structured water is still there. And the cell membrane is just there kind of, I guess, holding it in a somewhat structure, right? And so that's how we get this solute distribution. And then Gerald Pollack wrote this fascinating book called Cells, Gels, and the Engines of Life that explains how, like what we think of as an action potential that does physiology, that triggers for physiology in the body, or the trigger of a cell to divide or do cellular physiology is all driven by what he calls phase transitions, which is basically, think of phases of water. It's the structured water going back to a liquid state. And that creates a decreased voltage for a second because the voltage is held by the structured water. You lose the structured water, you lose the charge, and then it comes back. All right, but that change in voltage triggers for cell division and for protein making and all this different stuff. It provides the energy to do that, the signals for that. He talks about how phase transitions are responsible for muscle contraction and all these different things. So it's an entirely different framework of looking at physiology, but it makes sense when you look at the big picture of how life is on the planet. We're all trying to gain energy and we're trying to store that energy in structured water. And we need other things to do that, but that's what provides the energy for life. And so why are we sick? We've removed ourselves from those energy sources, added things that interfere with or that insult the energy source. And then once the damage has happened, we've interfered with the body's ability to heal from it through disrupted circadian rhythm and poor metabolic health. There it is right there.
Can we measure structured water at all?
I don't know about in the body, but I know that in Dr. Pollack's lab, they've measured like the amount that will form, on a hydrophilic surface, and they've taken different things to make it build more and measured how much it will build it. And far infrared light was the best at doing it. But yeah, I don't know. I mean, I guess by proxy, you could look at markers of inflammation. Inflammation is just low body charge, in my opinion. Inflammation just means too much, like we've lost our alkalinity. You can, like, there's tons of studies that show that a change in pH of an area is an indication of inflammation. So when the cell loses its slightly alkaline pH, which means alkaline means a little bit more negative, which means less structured water. You've lost your alkalinity. So that's what inflammation is. So markers of inflammation could be an indication that you're losing or you have low structured water in your body. I mean, you could say an erythrocyte sedimentation rate, where you look at that and the red blood cells are clumped together. There's low charge there, right? There's not enough charge to keep the red blood cells evenly spaced. You could consider that by proxy, a measure of structured water. But yeah, there's no like device that will measure the structured water in you. But actually, that's how MRIs work. They align the water molecules in a way that they can take an image through it. And like Gilbert Ling's work with structured water is what led to the development of MRI machine. And he was like, "Are you not interested in like the other things that this shows us?" And they're like, no, we just want to make an MRI machine. Thanks. That's the story he tells in one of his books. So yeah.
Dr. Hussey, before we wrap up, I want to bring diet into this. I know you're a fan of the low-carb diet, ketogenic diet, but let's tie that into the structured water piece and how they interact.
Well, I like low-carb diets and technically, I guess, ketogenic diets. I think they're fine, especially for someone like me who's type 1 diabetic trying to control blood sugars. But I'm not myopic about diet. I think that we should eat whole foods. That's the most important thing. And we should eat in a way that creates metabolic health. What I mean by metabolic health is that your body can easily go back and forth from burning glucose and fatty acids reasonably fast. So if you eat a high carbohydrate diet for a long time, you lose the ability to make ketones. And you have to kind of restrict carbohydrates and force your body to upregulate those mechanisms to do it again. So that's not a state we want to be in. So we want to create metabolic health. And the easiest way to do that is eat whole foods. I think animal foods are critical to our health. One of the reasons being is that we just talked about how DHA, which is an omega-3 fatty acid only found in animal foods, is critically important for you taking sunlight and making electrons from it. So specifically in seafood, we get high amounts of DHA and grass-fed animal products and things like that. So I think that's very, very important. And the reason that's related to structured water is because we all learn, again, about ATP in cellular physiology. We learn this, the most important thing. That's the reason the mitochondria there make ATP. But in reality, the mitochondria make ATP. They make reactive oxygen species, which are important signaling molecules that tell you about metabolism and lots of different other things in the body. There's some fascinating quantum aspects of reactive oxygen species, but also you're making infrared heat. We all know that we're emitting body heat. So there's your structured water former right there. Is if you have a healthy metabolism, you're making structured water by releasing the heat. And you also make water as a byproduct. I remember being taught, those are just byproducts of metabolism, right? And ATP is what's important. When in reality, the water is probably the most important, right? And so that's perfectly energized, deuterium depleted water that will go right into the cell and stick to a protein, become structured water on a protein. So that's like when I say hydration and the cellular level is more about metabolism, that's what I mean. Like, we're going to hydrate yourself when you take those electrons down an electron transport train and you get water as a product of it. So yeah, that's why that's super important to have that metabolic health and eat a diet that creates metabolic health. But I'm not dogmatic about what that should be. I'm a huge fan of centering your diet around animal proteins. That's going to create satiation and give you, because it's giving you protein, vitamins, and minerals, and give you a good source of efficient energy, which is fatty acids. And then create variety with plants if you want to. But I would advise to eat seasonally, because I do think that there are signals given to us from food from our local and seasonal environments that tell our physiology different things to do. It's also just better for a lot of different reasons. I think the food's more nutritious. There's generally less toxins, and that type of stuff. So yeah, I eat whole foods, center a diet around animal protein, create variety with plants in season.
All right, we're going to leave it there for today. Really enjoyed the conversation. You've broken a lot of paradigms, gotten us thinking out of the box, and yeah, it'll be interesting to see how all this plays out.
Yeah, thanks for having me on.
We're going to link up your books, your social media, your website, everything in the show notes. Thank you.
Thank you.
Now that you're done, you're going to want to stick around here and catch this other incredible episode. You don't want to miss it. I'll see you over there.
And I started looking into it, and a bit like the film The Matrix, where you take the red pill instead of the blue pill, and you suddenly realize, at least in this area of medicine, it's all just started to fall to pieces.